close your eyes for a minute. Now imagine yourself as an emergency nurse who's helped people in their darkest hour for over 30 years. Imagine you haven't been to your doctor for ages because, well, you're a nurse and you know what's going on with your health. Imagine you went in for some blood work prior to an elective surgery, but only because it was required. Imagine waking up after a well-deserved nap on a Friday afternoon and hearing a message on your voicemail from your doctor saying, if you're still my patient, you need to make an appointment right away because you have some abnormal lab work that we need to talk about. My Monday morning appointment couldn't come soon enough. In one short conversation, I heard 3 words that changed my life. You have leukemia. Chemotherapy and radiation would treat it, but a bone marrow transplant was my only hope for a complete cure. Early on, I wanted to keep my diagnosis private. I felt that if I admitted I was sick, I'd have people feeling sorry for me. I didn't want to go to a support group where I was afraid I'd see hopeless people. I struggled with my choice, but everything changed the day I made the decision to go public. They say it takes a village to walk with you down the cancer road. I found it takes many villages. I had my family village, my work village, my community village, and my church village. Everyone intertwined to support me and my family in carrying me in my darkest moments. I met people I never would have met otherwise, and I've become closer than ever before to others. My detour through the valley of leukemia was certainly not all rainbows and roses. Was I scared? Absolutely. I needed stem cells from bone marrow to survive. Being a bone marrow donor is a huge commitment. The only thing that scared me more than the diagnosis was the thought that my 3 brothers who lived out of state wouldn't agree to bone marrow donor testing. Or if they did, none would be a match. Fortunately, they all agreed, and one was a perfect match. It's times like this when you really find out how important family is. Did I go through dark times? Most definitely. I embraced and acknowledged the bad times and chose to move on and celebrate the good things that came my way. A few symbolic items have helped carry me through my journey and will always remain close to me. When I went in the hospital for my transplant, I asked my husband to find a special rock that I could hold to remind me of him. He's been my true rock and fortress from day one. That rock sits on my desk at work to remind me of how far I've come and the strength and love he has given me. As I was walking out the doors of the hospital on discharge day, on my way to a new life, the social worker slipped a small key into my hand. She said, "You earned this." The key has the word strength written on it. It took me a while to understand the symbolism of that simple word. Now I do. That key symbolizes the key to life after leukemia. It was up to me to open the door to that new life and begin my second act. One of the most important lessons I learned on my journey was patience with myself, my family, and my healthcare team. In the early days after my transplant, I was physically weak, but mentally strong. I would set small goals for myself, like walking to the end of the block or going to church. As my leash at the cancer center became a little longer, I gained strength and started doing hikes and planning little trips. I continued trying to define what my new normal and my second act would be. 6 months after my transplant, I got to travel to Oklahoma for my son's graduation from basic training. I felt like I was on the vacation of a lifetime. I was doing what normal people do. 1 year after my diagnosis, I was given clearance to return to work, as long as I didn't have patient contact. The bedside nurse in me really struggled with that, but I was able to define nurse in a different way. As a trauma outreach coordinator, I transitioned from being an ER nurse to being in the community teaching injury prevention. On my 1-year transplant anniversary, I felt like I had conquered the world. I wanted affirmation that I was alive and well. How'd I celebrate? I went skydiving! Reaching out and touching the sky was an amazing moment. Although probably not the smartest thing to do for someone who has no platelets. From way up there in the sky, I could feel myself heading back to life's main road and knew I wanted to spread the message that there is life after cancer. That would be my second act. Being on the other side of the hospital bed gave me a whole new perspective of what a patient goes through. Using my experience, I speak to nursing and medical students, giving them a view they wouldn't typically get in school. I also speak to bone marrow transplant patients. They hear about the whole transplant process from their healthcare team, but sharing my journey gives them encouragement. I give them a walk to wellness packet that has a pedometer and a journal in it. Hearing that attitude and exercise play a huge part in their recovery is good medicine, and it helps them see that while the road is long, there is light at the end of the tunnel. People have asked me, at what point do you start counting how long you've survived? My survival started the day I received my diagnosis. It was then I made an affirmation to fight and go where the detour in my life's journey would take me. Early on, my doctor and I made the pact that I wouldn't look at research that showed life expectancy after my type of leukemia. I have kept that promise. To this day, I don't know how long I'm expected to live, but to be fair, who among us really does? I feel like each of us is unique and will travel our own journey, regardless of the statistics. I'm not just surviving, I'm thriving. I've made the choice to live every day like it matters. I have to say that while skydiving was on my bucket list, leukemia certainly wasn't. But as a result of my disease, I have a new passion for life and can't wait to see what the future holds. Embrace your journey and take each day a step at a time. Let yourself be open to the help of those around you. Celebrate the little things. Live your life like it matters.